everyone, my name is Cassie Edlund and I'm a Student Communications Specialist at the Upper Midwest Agricultural Safety and Health Center, or UMASH, which is one of the 11 Centers for Agricultural Safety and Health funded by NIOSH. And today I will be talking about responding to emerging health and safety risks in agriculture using a strategic approach to assessing and leveraging resources. I would like to thank my fellow colleagues at UMASH who have helped support this project, and their names are listed below. One of the aims of our outreach and communications team is to respond to issues impacting the health, safety, and well-being of agricultural communities by strategically disseminating appropriate content with UMASH messaging. This process includes identifying emerging issues, gauging audiences' need, appraising, assessing, and leveraging resources. Today, I will primarily focus on how we strategically assess both internal and external resources to respond to highly pathogenic avian influenza in the Upper Midwest region in March of 2022. HPAI, also known as bird flu, is a serious, highly contagious disease that is often fatal to chickens and turkeys. To minimize the spread and subsequent impacts on farmers' physical and mental health, we gauged there was a need for our audience to know preventative measures to then minimize risks. So we decided to create and disseminate a toolkit with both internal or UMASH resources and external resources outside of UMASH, so we could connect our audience with accurate, timely, and regionally relevant health and safety information. The goal was to ultimately ease the process of searching for current information so our audiences could respond quickly to the developing situation. As we were looking to see what resources we wanted to feature to our audiences in the toolkit, we found ourselves coming across a lot of different resources, especially after the 2015 HPAI outbreak. And so as we were reviewing through an iterative process, we came up with the following criteria that we felt would best fit our audience and give them the information that they needed to respond quickly. So these criteria are listed here in this diagram, and it includes quality, coverage, resonance, appearance, and accessibility. So to assess quality, we looked for information that was consistent with the best scientific evidence that was available at the time. We also looked that it had updated factual information and appropriate sources. Then we looked at coverage to see if the scope of the resource matched the purpose of our toolkit or filled any gaps that we may have had. And so then we prioritized resources that offered supporting materials in both brevity and depth, so our audiences could access quick information if they wanted, or if they wanted to learn more about a specific topic. Then we assessed resonance with our audience to really look to see if the resource would fit our audience in terms of region, field, or occupation. We also considered that, yes, it's credible, but would it be seen as trusted by our audience? Appearance was also an important factor, and we checked materials to see if they were well organized with a logistic flow, and we chose materials that had some engaging graphics or images that would really draw our audience's attention and potentially serve as practical use. Lastly, we assessed accessibility by reviewing if materials were appropriate for our audience. We looked to see if they used plain language and if they were offered in multiple languages. And we also wanted to ensure that every resource that we included was publicly available and free to access. So after this process, we decided what internal and external resources we wanted to feature in the toolkit. We then created the toolkit on our website that was publicly available to people and shared it with our partners and audiences, as well as in our email and social media. To ensure the ease of navigation of the toolkit, we arranged the toolkit into 3 sections. The first section of the toolkit arranged resources by key preventative measures so our audiences could be informed, learn how to practice biosecurity, monitor their flock's health, and know who to contact. The second section of the toolkit included resources by role, as well as high-quality resources we wanted to prioritize. Our last section of the toolkit included a carousel of more visually appealing and practical resources, such as posters that could be hung up in the workplace, fact sheets, or cards that could be printed. Now for key takeaways. Some considerations of this specific approach to create a toolkit is that toolkit development is just one of the many approaches to respond to emerging issues. Some scenarios, such as HPAI, are very conducive to creating toolkits with the multitude of evidence-informed resources that are available to assess. However, other responses to health and safety issues, such as in early 2020 with COVID-19, required more real-time tactics from our outreach and communications teams. Through this process, we recommend implementing a strategic approach to assess the quality, coverage, resonance, appearance, and accessibility when determining what resources are best fit to respond quickly and effectively to emerging health and safety risks. I want to thank you for taking the time to listen today. Feel free to contact me with any questions or insights you may have around this work. Again, many thanks to my colleagues and collaborators at UMass.